remember this one. So let's just go off the. Oh,
One second, I've just got to call our transplant
Yeah.
Hello, it's Katie.
Okay, Cincy, I've got another patient. Yeah? You'd think you'd get away, wouldn't you? Yep. I'll get you to have a talk to the transplant coordinator who can tell you a bit more about the procedures. But if one of your children were matched, then we could use them, or we'd do what some call a matched unrelated donor search from overseas. That sometimes can take 3 months to work anyway.
He's got sisters overseas in Syria.
Oh, we can get them tested. Yeah.
But anyway, that's all right. That's something. But sorry, Doctor. Can I just because I'll just otherwise I'm going to forget it. So what are the two options that those two that
azacitidine, which I'm going to get organised now.
Azacitidine,
which are the injections.
The injections, yeah. So those injections are 7 working days.
Exactly as you said.
Yep, and then 3 weeks off, and then come back 7 working days. And how long are you in here for when you're doing the injections?
10 minutes.
Oh, 10 minutes. Okay. So you're in and out. No, you're right. Hello.
Okay. So this is Dr. Saba.
Hello.
Hey, how are
you? Saba?
We've had a polycythemia rubra vera, and he's just transformed to acute leukemia, low blood acute leukemia. So I'm going to be starting on an azacitidine and considering him for transplant. Now, he doesn't want to proceed down that route at the moment, so if you want to give me any information that you can and have a discussion with his son and him and he's got relatives in Syria, but no siblings in Australia. But he's got 3 children, so we'll be going down the route of a matched unrelated donor transplant and children as well.
So how do you determine the match? Is it just a blood test?
Yes, blood test.
Okay. Yep.
And the collection of stem cells for the bone marrow transplant would be from the blood.
Oh, so just a blood again. So is that?
It's a big deal. I'll go through it.
Yeah, sure. Okay.
It's not a little deal. It's
Sure.
a big deal.
Okay.
It's still Saba.
S-A-B for Bob and A for Saba. Yeah.
Okay.
So that's the first one. You come in 10 minutes injections. You do that for 7 days, 7 working days, and that's indefinite. So what do you like about that one?
It's usually relatively well tolerated.
Okay.
I have had good responses to it in some patients. Not everyone responds though.
Yep.
And we can keep on doing it until there's progression.
Okay.
What I don't like about it is it's not curative.
So it doesn't actually cure the Okay. It just prolongs.
Yeah, it can put. I mean, like I said, I've got one guy who's had 57 weeks, 57 months with it.
57 months, right?
57 courses. I've got another lady who had her 25th course.
Okay.
Yesterday.
After that, they died, or they just
Big pardon?
after 57 course, what happened?
He's continuing on
It
it.
just continues until it just stops reacting.
Yeah.
Okay, and that's a bit of a pain because you're in, but you're coming in 7 days, but that's okay. It's not a big deal. You come in, you leave. You come in, you leave.
So if you want to go, you can go. He's got it.
All right. Can I just get your name?
Yeah, Michael.
So just thought I'd just introduce you, Dave.
Thank you. Yeah, thanks for that.
And can I get your mobile number?
0410
0410
644
644
937.
Excellent. I'll give you a call later on.
Yeah, that'd be great.
Right,
Yeah,
nice
thank
to meet
you.
you.
Okay.
Thank you very much.
Dave's quite out at the moment.
Yeah, no, that's all good. Thanks for
very
coming
much.
in. Thank you. Okay, so that's sort of, it doesn't cure. However, the transplant option.
Yes.
You've got
Cure or kill,
okay.
so to speak.
Yeah.
Like I say, 100-day mortality 20-30%. Chance of cure probably 50%.
Yep. Okay. And then God willing, chance of cure. What's the expectancy after that?
Normal in terms of his age, but there are complications such as graft-versus-host disease, and he'll be on medications. He'll be coming back to the hospital 3 times a week initially, and then weekly, then monthly.
Yep.
Immunosuppression, which is predisposed to infection. So it's a big deal. He's be coming back here very, very frequently.
Right. And that can go on for years?
That
could go on for years. Yeah. So what stage would it be at then at the moment?
He's got low blast count acute myeloid leukemia.
Which is is that it, like, you know how they talk stages?
They talk stages in oncology, not hematology.
Right, okay. Can I ask this? If we go down the path of the injections, if Dad decides
We're going to do that anyway.
Sorry?
I'm going to do that anyway.
Oh, right,
Until
okay.
you decide what
Okay,
to do.
right.
I'm going to get that started now.
So we can get that started,
Yeah.
and that could go on for the next, let's just say, 12 months, and then decide we go down
Well,
this
the older he
path.
gets, the less likely I'm likely to go down that route.
Right,
Okay.
right.
When you get to this age,
Right.
He's on the borderline now. Really on the borderline.
Okay.
I mean, he's on the borderline because the mortality increases as you get older.
For the transplant stuff, yep. And that's a bone marrow transplant.
Stem cell.
Stem cell transplant,
Stem cell
okay.
bone marrow transplant.
Okay.
Okay. I've got the information for you.
Yep.
And I need to get all the stuff done. And
Yep.
then I'll go through things with you in detail, okay? But I've got
Okay.
to get consent and all these things signed, so things like
Sure.
that, that sort of stuff.
So when did you want to start that for Dad?
No,
Straight
no,
away?
it's a big deal, okay? Nothing starts when you want it to.
Yeah.
Okay? That's the information about the acytidine.
Okay. That's the injections? Yep,
That's the
okay.
injections.
Okay.
Okay, let's see what we're doing.
Now, is that all done here as well, Doctor? These the injection ones? Yeah. Yeah. Okay, that's good.
Alright. Thanks for the, they gave me green whistle. Green whistle, I wanted to work on that. It was very good. But after they, wonder. I think it's like a little one, I sit down.
That's a while, yeah.
Really good. But there's a problem, right?
It was good.
Oh, it's only my first things.
That's good.
Just a little bit, but not.
So you got to look at probably also the changing maybe your diet too, like anyway. You know,
Yeah.
That's yeah, that's good. You've done this
Come
one.
with me, I'll get you home your weight. There's a blood form left around in the pathology for you. I think I've written everything on it. You need to have a blood test every time you come along here.
Another blood test?
You need a blood test every time you come along here.
Okay.
Left in pathology. Unfortunately, that's the way it has to be.
Well, Dad, you're not working, so you got the
Yeah,
time.
that's all right.
You come in, you get your injection, and so are you saying with the injection, sorry, if he comes every day, you want him to get a blood test every day as well?
No, just at the start of each cycle.
Oh, okay, so once a week.
No,
Type of
once a
thing.
month.
Once a month, okay.
You may need blood transfusions.
Right, okay.
I'm still taking the hydria or don't not anymore?
We stopped that ages ago.
Yeah, so forget about that. Yeah.
Forget about that now.
Okay.
Yeah, for the moment.
I mean, what I've got, throw it away or leave it?
I just hold on to it, yeah.
Just hold on to it for now.
Okay.
Yeah.
Okay, now I'll get you get all signed for this. I'll give you all the information, you can read about it, and if you want to change mine, that's fine, but I want to get everything done now.
That's
all
fine.
right? Okay.
Yeah, let's just get it done.
Try to needle, huh?
Yeah, this, the needle and the, yeah. So,
Well,
no,
let's start that today or next week?
It won't be this week. So this, all I have to do lots of forms and send things, prescriptions off to Hobart. I have to do heaps of stuff. Okay, it's not like just coming in having a
Okay.
lots of organisation.